So welcome everyone. Thanks for joining us. Today we are here as Bloocell, and at Bloocell we are redefining healing by regenerating tissue using 3D printing technologies to make bioscaffolds using biomaterials. And here we are here today with our doctors and our guests, and we'll just have a talk about who they are and their experience with Bloocell. So let's start with you, Dr. Jem. Can you please briefly introduce yourself, and then can you please tell us more about the products that you are using?
First of all, I would like to thank for you to this organization, this fair. My field is I'm an oral and maxillofacial surgeon, and I work in Karadeniz Technical University as a professor in my department. I first met Bloocell at 2023, I think, in first cases, and we worked together from this date. Bloocell, first of all, opened me a new generation, new era in my field, scaffold guided regeneration. I learned this topic with Bloocell. Alveolar bone regeneration or guided bone regeneration most popular in my field, but scaffold guided bone regeneration and 3D customized bone regeneration use these technologies so privately to all patients is very important for us, and Bloocell opened this era for me, and I made a lot of cases, and I made a thesis, my colleague, on this. It's not published yet, but we prepared it to publish, and now we made another topic on this. We use Bloocell as mini plates and screws, and new era, also new challenge.
Great.
We are improving. Bloocell improves us also. I can talk like this.
Great. I have also another question. Where do you see Bloocell in the future, within 5 years, 10 years?
As a Turkish company, I'm very proud of Bloocell, and I support firstly in this. But I admire the product and the company, and maybe 10 years we will be in the tops.
Great, thank you. What about you, Dr. Mehmet Billy Karalton?
You can call me Dr. K.
Dr. K,
Much more
yeah,
easy.
sure. Great.
Yeah.
Can you tell us about yourself and your experience
Absolutely.
with Bloocell?
First of all, I would be grateful to thank you and thank the company for the invitation to be in this huge worldwide event, which is held here in Düsseldorf, Germany, and at Medica. And I'm actually excited that as a company, as in your level, is being very active globally, and being in Medica is actually one of the signs that gives a good impression for international collaborations in the future. Well, first of all, I'm a plastic surgeon. I'm a professor in plastic surgery, and I'm a specialist of maxillofacial as well as microsurgery in hand. And I've been dealing with microsurgery since 20 years. And well, for reconstructive surgery, I think that tissue regeneration is our major scope, and wound healing is actually what we're dealing with, even in the cosmetic procedures, which is quite now popular worldwide. Well, I believe that bioscaffolds is the new generation model in medicine. And of course, there's a lot of application modalities. It's not just in plastic surgery, neither in surgery itself. It might be in different scopes in medicine, like, targeting medications, like targeting tissue to heal in the way that we want it to heal. So basically, our application field here now in plastic surgery is more confined to the tissue regeneration and tissue engineering models, as you can assume, as you can realize. And of course, my experience with Bloocell was 3 years ago when we started to be confronted with it. Actually, I had a very long passed away when I was using it in 10 years or 13 years ago, but I was not using it as Bloocell. But I believe that Bloocell has made an innovation, let's say a strategical change, a game changer in PCL, especially PCL bioscopals, because one of our problems was the reaction of the body, the overt reaction that was happening and was actually constraining us to use it in different modalities. But now we know with your innovation, actually, you guys have done a very good job. We have minimized these almost to zero, and I'm actually very happy to use it in a wide scope of modalities in reconstructive surgery. So it's a wide spectrum from nerve regeneration to cosmetic procedures. And I know it's quite diverse. It conveys a lot of diversity in plastic surgery in particular, but I believe in the other disciplines it's also very applicable, and I just think there's a bright future for you guys, and I believe that you can easily be globally to be internationally spread all around the world. It just needs a little bit of time and effort, and I know that you guys are working hard for it. Yeah.
Great, thank you. Thank you so much. And welcome, Dr. Cengiz Gebitekin, our thoracic surgeon. Can you please introduce yourself?
Thank you for the invitation. And first of all, I would like to thank you to the Bloocell for inviting me. Also, for being here, it's a great pleasure for me. I'm Cengiz Gebitekin, working as a professor of thoracic surgery. We've been using the product, the Bloocell PCL, started 3 years ago. And of course, we're covering the chest wall defects, in the meantime, the sternum, and also in the future, I'm sure I will be using this product for covering the defects on the trachea or the bronchial tree, maybe with the tissue regeneration, like exosomes or the stem cells. So there's a very bright future for the company. Thank you.
Thanks. And Dr. Doğan Baykut, can you please?
My name is Doğan Baykut. I'm a cardiac surgeon. My background is cardiac surgery, also general surgery. I used to work in a hospital for a longer time, but also in traumatologic cases. And I'm actually very new in this group. It was more or less coincidental. I met Mustafa. And I'm in Switzerland, and we were talking about these possibilities. My colleagues already talked about. I have no clinical experience at this time because cardiac surgery is not a directly interfacing with lots of technology. But after my talk today with my colleagues, and then we found out several possibilities, especially in sternal deficiency problems. The only crossing point of cardiac surgery with bones is the chest. The chest problems are not very common, but if they are there, we have difficulties and we have severe problems with the patients, especially with their breathing, and breathing is very important for post-operative cases, post-operative treatment of the cardiac patients. Anyway, so I see a lot of possibilities to use this technology in different types of surgery, as my colleagues do. My personal role in this system is to establish the Bloocell technology, which is wonderful and is more or less unique in the world. In Switzerland, from Switzerland, going to different areas in Europe. And therefore, I have two different roles in this topic. First one is a clinical one, to expand this technology into clinical cases. And the other thing is to bring this technology in a level in Europe that has a Turkish company which is very proud to us in an international level. So I think it's a very interesting and very good job to do for me.
Thank you.
Thank you very much for
Thank you.
inviting me.
Well, thank you all. Thanks for your input and all your support throughout this time, for supporting us, for trusting us, and keep up the good work for all the team. Thank you.